Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Atomoxetine. Its brand name is Strattera. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Atomoxetine is classified as a selective norepinephrine reuptake inhibitor. In terms of indications for use, this medication is indicated to be used in the treatment of attention deficit hyperactivity disorder, or ADHD. Now, before somebody was to use Atomoxetine, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. First off, patients would not be able to use Atomoxetine if they've used a monoamine oxidase inhibitor in the previous 14 days. If a patient had a hypersensitivity to Atomoxetine or any other component of the product, they would not be able to use this medication. Patients with narrow-angled glaucoma cannot use Atomoxetine. And patients with severe cardiac disorder that would be at a risk of deterioration if there was an increase in blood pressure or an increase in heart rate also cannot use Atomoxetine. Now, in terms of precautions, patients should be made aware that sudden death, stroke, and myocardial infarction or heart attack has been reported in adults using this medication. Orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position, sometimes with fainting, has occurred. And new or worsening of aggressive behavior or hostility has been reported with the use of this medication. Priapism has been reported in both adults and children using Atomoxetine. And growth in terms of height and weight have both been affected by patients using this medication. Psychotic or manic symptoms has occurred in children and adolescents using this medication, and this could occur in patients with a history of mental illness or in patients that don't have that history of mental illness. And finally, patients should be made aware that liver failure has occurred with the use of this medication. And once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Atomoxetine, they can expect to receive their dose orally. So if somebody is using this medication to treat ADHD, they would typically start off with a dose of 40 milligrams given once daily. The dose can then be increased after a minimum of 3 days to a target dose of 80 milligrams that could be given once daily or twice daily in the morning and late afternoon. After about 2 to 4 weeks, the dose can be increased again to 100 milligrams if necessary, and that would be the maximum dose. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Atomoxetine, so I'll go over some of those here now. Up to 10% of adults may notice an increase in heart rate. 2 to 3% of patients may notice a decrease in weight. Abdominal pain, constipation, and a decrease in appetite are possibilities. And some patients may also experience nausea or vomiting. 8% of adults may notice dizziness. And some patients may experience a headache. Some patients may experience somnolence, and up to 10% may experience fatigue. Some patients may also notice a delay when they start to pass urine. Some more rare but serious side effects would be myocardial infarction or heart attack, tachycardia or a rapid heart rate, liver failure or cerebrovascular accident, and psychotic symptoms or manic symptoms. That's all we're going to talk about today with Atomoxetine or Strattera. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.